Thank you, Deputy Speaker. At the last election, we made a clear commitment to the Australian people, not only to strengthen Medicare, but to ensure that after a decade of cuts and chaos from the opposite, Australia would have a healthcare system that's accessible, responsive and truly works for the people who rely on it. At the heart of that system is our health workforce, the frontline workers who dedicate their lives to caring for us, our families, our communities, and when people need them the most. They are the backbone of our healthcare system, and the strength of Medicare depends on our ability to support and enable them to deliver the best possible care. Whilst this bill directly affects the work of registered nurses, it is fundamentally about everyday Australians, people who find themselves unwell, caring for a loved one, or trying to navigate a system that often feels complex, slow and difficult, precisely at the moment when they need support the most. This legislation is about making our health system work fairer and better, and it is where we need it to work. It is about ensuring people can access the safe, affordable medicines without unnecessary delay, and about empowering our health workforce to work to its full potential so patients receive timely, high-quality care. The Albanese Labor government also made a clear commitment to prioritise scope of practice reforms for health professionals. We did so because we know our health system is under pressure, and with growing demand, workforce shortages and communities rightly calling for care to be more flexible, more efficient and more centred on their needs. This bill delivers on that commitment. It is practical, sensible reform that strengthens Medicare by modernising how care is delivered and ensuring highly trained health professionals are able to contribute fully within their scope of practice. It recognises the challenges facing our health system cannot be solved by standing still. They require thoughtful, evidence-based reform focused on people, not process. And that is why this reform is so important. Deputy Speaker, this bill enables designated registered nurse prescribers to prescribe certain medicines under the Pharmaceutical Benefits Scheme once they are appropriately trained and endorsed. It does this in two ways. First, it amends the National Health Act 1953 to recognise registered nurses who are endorsed under the National Registration Standard as authorised prescribers, allowing their prescriptions to attract Commonwealth subsidy through the PBS. Second, it amends the Health Insurance Act of 1973 to include registered nurses within the Professional Service Review Scheme, ensuring appropriate oversight, accountability and patient safety. These are careful and considered changes. They ensure that as nurses' roles evolve, the legislative framework evolves with them, supporting quality care while maintaining the integrity of our health system. Taken together, these amendments ensure that our laws keep pace with modern clinical practice and the realities of how care is delivered on the ground. They make it clear that when a registered nurse is appropriately trained, endorsed and practising within a collaborative framework, that we recognise their clinical judgment and support these incredible healthcare professionals in our national health system. By enabling access to PBS subsidies while maintaining strong safeguards and oversight, this bill strikes the right balance between expanding access to care and upholding the high standards Australians rightly expect from their Medicare. Deputy Speaker, those of us on this side of the chamber have always recognised the incredible role nurses play in keeping our country healthy. Indeed. And our member for Bullwinkle. Nurses are often the first clinicians people see and ones who stay with patients throughout their care. They work in our GP clinics, in hospitals, in aged care homes, community health services and mental health settings, building relationships, providing continuity and delivering care with skill and compassion. And, Deputy Speaker, I'd like to take this opportunity to recognise some amazing nurses who looked after my daughter Guinevere when, in the final week of school holidays, so just a couple of weeks ago, she had to have her appendix taken out. The nurses at the Royal Children's Hospital in Melbourne were incredible, keeping Gwenny calm and in good spirits whilst recognising how scary this procedure was for her and helping her take the medicine that she needed, sometimes with much protest. My heartfelt thanks to every single nurse, doctor and healthcare professional that helped support Guinevere and looked after us and our entire family when we were there a couple of weeks ago. This bill recognises that many registered nurses already have advanced training and expertise, and with that, the right education and safeguards can effectively and safely take on expanded prescribing role. The National Registration Standard endorsement of scheduled medicines designated registered nurse prescriber was approved by the Health Ministers in December 2024 and came into effect in September 25. It sets out clear, rigorous requirements that registered nurses must meet and attain and maintain endorsement. The first cohort of designated registered nurse prescribers is expected to complete their education and receive endorsement and to begin prescribing by July 26. This reform, done properly, grounded in evidence and education and professional standards. Deputy Speaker, designated registered nurse prescribing is based on partnership, with nurse prescribers practising in collaboration with authorised health practitioners under active prescribing agreements. That collaborative approach has been central to the design of this reform, and it is why it has received support from across the health sector, including through extensive consultation and organisations such as the Royal Australian College of General Practitioners and the Australian Medical Association. This shared approach reflects a modern understanding of healthcare, one that values collaboration, respects professional expertise and keeps patients at the centre. Deputy Speaker, the real impact of this bill will be felt by patients and communities, including those communities I am proud to represent across Maribyrnong. Maribyrnong is a diverse and growing electorate, with families juggling work and care responsibilities, older Australians ageing in place, and many people managing chronic and complex health conditions. Like many communities across Australia, we rely heavily on strong primary and community-based care to keep people well and out of hospital. In primary healthcare settings across Maribyrnong, designated registered nurse prescribers will be able to support patients with more timely access to PBS subsidised medicines, particularly for ongoing and chronic conditions. That means fewer delays, fewer unnecessary appointments and a smoother experience for patients, whilst also allowing general practitioners to focus their time and expertise. In aged care, in places like Winteringham and Avondale Heights, where many residents live with multiple health conditions and frequently require changes to medication, this reform supports faster clinical decision-making and better continuity of care. For older residents and their families, that means greater confidence that care is timely, coordinated and responsive. In disability and mental health settings, designated registered nurse prescribers will be able to contribute to medication management as part of a broader person-centred approach to care, supporting stability, dignity and recovery, and helping to ensure people receive the right care at the right time close to home. And in hospital settings, particularly at the point of discharge, this reform will help ensure patients can leave hospital safely and promptly with the medicines they need, easing pressure on hospital beds, improving patient flow and reducing the risk of people falling through the cracks as they transition back into the community. These are practical, real-world improvements that will make a meaningful difference in places like Maribyrnong. They reflect Labor's commitment to building a healthcare system that works for communities, not just on paper, but in practice. Deputy Speaker, this reform is also being delivered in a coordinated and genuinely national way. All states and territories are currently amending their drugs and poisons legislation to enable designated registered nurse prescribers by July 26. That level of alignment reflects a shared understanding that this reform is necessary, overdue and will deliver real benefits to patients no matter where they live. This national consistency is important. It means whether people are accessing care in a local GP clinic, in an aged care facility, a community health service or a hospital, the system is better equipped to respond quickly, safely and effectively to people's needs. It also provides greater certainty for our health workforce. Nurses who live and work in our local communities can practice within a clear, nationally consistent framework supported by strong professional standards and shared expectations across the country. Deputy Speaker, this bill is also about valuing and supporting our health workforce. By enabling designated registered nurse prescribing, we are creating clearer career pathways for nurses, improving job satisfaction and helping retain skilled clinicians within our health system. At a time when workforce pressures are one of the greatest challenges facing our healthcare system, supporting nurses to work their full scope of practice is not just sensible, it's essential. The Unleashing the Potential of Our Health Workforce Scope of Practice review, led by Professor Mark Cormack, was unequivocal on this point. It found that barriers to working to full scope of practice prevent the most effective use of the existing workforce and undermine the sustainability of our health system over time. This reform responds directly to that finding. It empowers health professionals to contribute fully within their areas of expertise, removes unnecessary constraints on safe and effective care, and ensures our workforce is supported to deliver more for patients. And it is another way that this government is strengthening Medicare, not just by investing in it, but by modernising how it works for patients, providers and the workforce who sustain it. Deputy Speaker, this bill is thoughtful, practical, forward-looking, but it is also something more than that. It is a clear statement of this government's values and our belief in a strong, universal Medicare system, one that evolves with the needs of our community and the community it serves and is built on trust in the people who deliver it every day. This legislation modernises our laws to reflect contemporary healthcare practice. It embraces evidence-based reform that supports collaboration, flexibility and patient-centred care. It supports our healthcare workforce, particularly our nurses, by recognising their skills, their training and their vital role across every part of our healthcare system. And most importantly, it improves access to affordable medicines for Australians. Now, in particular, now that we've made that even cheaper because of our government's cheaper medicines policy, just $25 a script, like it was back in 2004. It means fewer delays in care, better continuity for patients and a health system that works more smoothly, more fairly and more humanely, especially when people are unwell, vulnerable or caring for someone that they love. That is the kind of reform Australians expect from our Labor government, and that is exactly why I recommend this bill to the House. Thank you.